Sally arrives at the clinical office for a routine prenatal appointment. She becomes red in the face as she states that lately she has been craving and ingesting dirt. Which of the following is the most appropriate response from the nurse? A. You must be admitted to the hospital. B. Do you have a history of psychiatric illness? C. You must stop immediately. D. Where have you been obtaining the dirt that you're ingesting? E. Why would you eat dirt? The answer is D. Where have you been obtaining the dirt that you're ingesting? During pregnancy, many women crave and eat substances that adults do not generally ingest. This condition is normal and is called pica. Often, the substances do not have high nutritional value. Examples are dirt, chalk, rocks, toothpaste, toilet paper, etc. It is important to determine the risks involved with ingesting these materials. For example, the nurse must determine that a woman who is eating dirt does not ingest potting soil mixed with fertilizer and other potentially toxic chemicals. Your patient is under 24-hour fetal monitoring and observation. The fetal monitoring strip begins to show decelerations, starting after the peak of contractions and recovering late. Which of the following interventions does the nurse anticipate doing? A. Administering medication. B. Reposition mother. C. Fluid bolus with normal saline, NS. D. Removing oxygen supplementation. E. Increasing rate of oxytocin. The answer is B. Reposition mother. Late decelerations are caused by uteroplacental insufficiency. The nurse should anticipate many interventions to promote uteroplacental blood flow. Initially, the nurse should implement oxygen supplementation, stop the oxytocin infusion, reposition the mother to the left side, and introduce a fluid bolus of lactated Ringer's solution, LR. The nurse is reviewing a fetal monitoring strip. Decelerations are onset with the beginning of each contraction and recover at the end of each contraction. Which type of deceleration is this, and why does it occur? A. Variable decelerations, umbilical cord compression. B. Late decelerations, uteroplacental insufficiency. C. Early decelerations, head compression. D. Variable decelerations, head compression. E. Early decelerations, uteroplacental insufficiency. The answer is C. Early decelerations, head compression. A fetal heart rate, FHR, deceleration occurs when the FHR drops 15 bpm below baseline for a period of 15 seconds when the gestation is more than 32 weeks and 10 bpm below baseline for 10 seconds when gestation is less than 32 weeks. When the onset of the deceleration occurs at the onset of a new contraction and recovers with the end of the same contraction, the strip is demonstrating early decelerations, and the fetus is exhibiting head compression. Late decelerations occur when the deceleration begins after the start of a contraction and does not resolve until after the contraction has finished. Late decelerations are the result of uteroplacental insufficiency. A variable deceleration is caused by cord compression, and appears as a brief drop in FHR from baseline then resolves quickly, creating a V shape on the strip. Which of the following describes a Category 2 fetal heart rate, FHR, tracing? A. Baseline 100 bpm, absent variability, 1 acceleration, prolonged decelerations. B. Baseline FHR 170 bpm, moderate variability, 2 accelerations, 0 decelerations. C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. D. Baseline FHR 145 bpm, moderate variability, 2 accelerations, 0 decelerations. E. Baseline FHR 90 bpm, marked variability, 0 accelerations, late decelerations. The answer is C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. A Category 2 fetal heart rate tracing include all FHR tracings that are not Category I or Category 3. Category 1 FHR tracings are as follows: baseline 110 to 160 bpm, moderate variability, absent late or variable decelerations, present or absent early decelerations, and present or absent accelerations. Category 3 FHR tracings are as follows: absent baseline FHR variability, recurrent late decelerations, recurrent variable decelerations, bradycardia, and sinusoidal patterns. Which of the following is not a risk factor for gestational diabetes? A. Obesity. B. Poor diet. C. Previous stillbirth. D. Previous macrosomic infant. E. Family history of diabetes. The answer is B. Poor diet. Risk factors for gestational diabetes include obesity, family history of diabetes, history of gestational diabetes, hypertension, preeclampsia/eclampsia, recurrent urinary tract infections, vaginitis, polyhydramnios, previous large infants, 9 pounds or greater than 4,000 grams, glycosuria or proteinuria on 2 or more occasions. While poor diet may contribute to diabetic concerns, it is not directly associated with a higher risk of gestation diabetes as the other risk factors are. During the prenatal period, nurses are responsible for educating their patients on all of these risk factors as well as a proper prenatal diet.